I'm Steve. I'm a physical therapy student in my third year, my last year of physical therapy school. I've had a long-standing ankle injury that's bugged me for quite a few years, like 2 or 3. And I saw my orthopedist, and after telling me what it was and telling me about how we'd fix it and rehab it, he said, "I'm sending you to Katie. She's great with these kind of injuries, with these Achilles injuries." And so I came here and I was excited because of how encouraged Dr. Inda was to send me here. And I immediately felt comfortable getting here. I've worked in a couple clinics, and some clinics you feel immediately welcome, and this is definitely one of them. I came in, and not only did I get to know Katie, but I got to know Brent and Claire as well. Everyone's talkative in the gym. I'm naturally talkative, so I didn't have a problem getting to know those two, but it wasn't a thing to be able to easily talk to the other therapists and their patients. So I feel like I've gotten to know a couple of the other patients here too. It's always fun. I've never not had fun when I've come in. As a student, it's been interesting because I'll often talk to Brent and Katie about what's going on in my clinical rotations, and asking them things, and they give me feedback that I don't ask for that's very good when we're talking about stuff, and it's like, man, that's a really good point. They're all very good at educating on what's going on and keeping the patient in on their own care. We talked about a lot of the things that normally therapists do, and how their viewpoints as therapists have changed since they were in my position as a student. And it's really been interesting because they've encouraged me to be very critical of methods of treatment. And they've described how, originally they thought, well, I'm doing this because this is what I was taught, but I've done my research and I've found out that some of these things work a little better than others, and I've developed my own identity as a therapist. Both Katie and Brent and Claire. I haven't talked as much to Claire about it, but Brent's even handed me research articles a couple times. It's been very cool. So it's been nice. They've almost been a little bit of a mentorship going on too, in terms of how I'm developing as a therapist. I often come in and tell stories about what happened in my clinic that day, since I'm on a rotation right now. Bottom line is my ankle's better. I'm very tentative when it comes to treating things. I don't want to push too hard, and I very much trust Katie and her judgment on these things, and it's been really interesting to kind of care for my ankle together. Often voicing my concerns, and she'll take those concerns and give me really good feedback on them, and we've done it together. It's been really cool.